A 5-year-old male presents with muscle weakness that began in the pelvic girdle muscles and has progressed to affect the proximal muscles. The child has pseudohypertrophy of the calf muscles and exhibits a waddling gait. Genetic testing confirms the presence of a frameshift mutation in the dystrophin gene. Which of the following is the most likely cause of this child's condition? A. Defective mitochondrial ATP synthesis. B. Mutations in the sarcomeric proteins. C. Deficient dystrophin protein. D. Abnormal calcium handling in muscle cells. E. Deficiency of acetylcholinesterase in neuromuscular junction. Answer: deficient dystrophin protein. Explanation: Duchenne muscular dystrophy, DMD, is caused by mutations in the dystrophin gene, DMD, which encodes a protein that helps anchor muscle fibers to the extracellular matrix. In DMD, mutations such as frameshift deletions or nonsense mutations lead to the absence or dysfunction of dystrophin, resulting in muscle damage and weakness, particularly in the pelvic girdle muscles and pseudohypertrophy of the calf muscles. Question 2. A 7-year-old boy with Duchenne muscular dystrophy, DMD, is brought to the clinic for routine follow-up. The child has a history of progressive muscle weakness and a waddling gait. During the examination, the child has difficulty standing up from the floor and uses his hands to push himself up from his knees. This is known as A. Becker sign, B. Gower sign, C. Schwostek sign, D. Trousseau sign, E. Answer B. Gower sign. Explanation: Gower's sign is characterized by the use of the upper extremities to help the child stand up from a squatting or sitting position. It is a classic sign of Duchenne muscular dystrophy, DMD, due to proximal muscle weakness, particularly in the pelvic girdle muscles. It can also be seen in other muscular dystrophies and inflammatory myopathies. SMLE question. A 7-year-old boy is diagnosed with Duchenne muscular dystrophy, DMD. He presents with progressive muscle weakness, pseudohypertrophy of the calves, and difficulty standing up, Gower sign. Genetic testing confirms a mutation in the dystrophin gene, and his cardiac function is being monitored due to the risk of dilated cardiomyopathy. Which of the following is the first-line treatment for this patient? A. Gene therapy with exon skipping, e.g. eteplirsen. B. Corticosteroids, e.g. prednisone or deflazacort. C. Beta blockers and ACE inhibitors for heart failure. D. Sodium channel blockers for cardiac arrhythmias. E. Pancreatic enzyme replacement therapy. Answer: B. Corticosteroids, e.g. prednisone or deflazacort. Explanation: corticosteroids such as prednisone or deflazacort are first-line treatments for Duchenne muscular dystrophy, DMD. These medications help slow muscle degeneration, improve muscle strength, delay the loss of ambulation, and improve cardiac function. While gene therapy is an exciting area of research, it is not yet considered first-line therapy. Beta blockers and ACE inhibitors are used for heart failure once it occurs, but they do not address the underlying muscle weakness of DMD. Pancreatic enzyme replacement is used for pancreatic insufficiency, which is not a primary concern in DMD.